Hello, I'm Zeta Tomler from the Research Council of Complementary Medicine, and I'm here today with Dr. Emma Treby. Hello, Emma.
Hi.
Um, Emma won the prize, well, jointly won the prize for oral presentation at the Research Council for Complementary Medicine's conference this year. So I wondered, Emma, if you could tell us a bit about your research. What was the focus of your research?
Yeah, well, the focus of our research really was to look at the feasibility of using solution-focused hypnotherapy to treat anxiety and depression in a UK police force. So we were able to work with Northumbria Police for this piece of work. And yeah, we were really pleased with the results.
Gosh, and what an area, because I'd imagine anxiety must be huge working in the police force. And obviously the flip side always of that is depression. They're under so much pressure, aren't they? So to find something
Absolutely.
that can assist. So what led you to look in at the police force specifically? Were there any thoughts behind that?
Yeah, I mean, like you've just alluded to, the rates of anxiety and depression in the UK police force are so much higher than in the general population.
Right.
And sickness levels are at the point where there's a real problem with levels of sickness and therefore additional stress for those who are continuing to work within the force.
Oh,
Um, we're seeing rates of anxiety and depression of between 60 and 70%. And that's huge. And we know that within Northumbria Police, when we were working with them, we knew that that sickness was translating into a cost for the force of about 1.87 million per year. So it's a really difficult challenge.
yeah, yeah. And so to find something that's going to work and enable officers to get back to their work, and perhaps maybe even stop things getting that bad in the first place. That's really powerful work, isn't it? So what were your key findings? How did it compare with other things? How did it work? Yeah.
Yeah, well, it's interesting, isn't it, that within the police we couldn't find any data that specifically associated with levels of anxiety and depression in the police, and perhaps the most commonly used psychotherapy, such as CBT.
Yeah.
However, we were able to compare our findings with general findings of
Yeah.
CBT within the population.
Right.
And it's really interesting. One of the main drivers for us is when we were looking at the general literature around CBT, we were seeing that actually, it was up to 50% of those don't respond at all to treatment with
Right.
CBT.
Yeah.
That's not a good statistic
No,
to
it's not.
start with.
No.
But beyond that, of those that do respond, and those that do respond, fantastic. We know that of those that do respond, you're not getting a particularly good recovery rate.
Right.
And by recovery rate, of course, that means a complete removal of all
Yeah.
symptoms.
Yeah. Yeah.
Um, so you're looking at a recovery rate of CBT between 37 and 47%. And
Wow.
that's of
Okay.
those that
Of those
respond.
that do. Yeah. Yeah.
Yeah, absolutely. But one of the findings when we were starting to sort of research into this area is that there's a growing literature saying that we needed a new method, a new therapy,
Yeah.
because whilst quite a lot of different therapies might have that effectiveness of reducing symptoms of
Mm.
anxiety and depression, that wasn't necessarily translating into long-term wellness,
Yeah.
and that actually there needs to be a therapeutic tool that enables people to improve their mental well-being as well.
Yeah.
And we knew that that fitted really well into the solution-focused hypnotherapy model, because that's precisely what we are
That's the
working
plan.
with.
Yeah.
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 All the therapists that took part in this process volunteered their time to do it.
Yeah.
Everyone that took part knew anecdotally that it was a really effective therapy. So it was just so wonderful to be able to start the process of demonstrating that.
Yeah. And so what were the figures in the end? How did it
Yeah,
come
the
out?
figures in the end. Obviously, inevitably there's going to be a little bit of drop off in terms of numbers. But of those that completed the therapy, 100% of participants that completed therapy responded. So that was at least a 25% reduction in those symptoms.
Fantastic.
But beyond that, there were 78% of those that actually completely recovered. So that was no symptoms whatsoever in terms of anxiety and depression.
Wow.
But that well-being I was talking about was also measured. So we used a wellness tool to measure people's well-being right from that initial consultation through all of the sessions. And we saw an 84% increase in their mental well-being. And of course, we know that that's the key to their long-term
Yes.
health,
Yeah. Yeah.
in, staying in work, coping with those really tricky pressures.
Well, and it presumably saves the police force a lot of money to have them in their jobs and working effectively as well. Well, that's incredible, isn't it? I mean, what a
Absolutely.
start point. Yeah. So, well, thank
Yeah.
you for sharing
It
that.
was,
That's
it was,
really, yeah, it's so powerful. All great figures and can presumably be rolled out in so many different areas.
we would
What
very
next?
much like it too. I think
Yeah.
what next? Oh
Yeah.
gosh. I think that what next is, it's lovely to have the facts and the figures, isn't it? The statistics of those
Yeah.
improvements. But we also, it was a mixed methods project. So we did look at the qualitative side as well. We were really interested in those participants, how they felt about the therapy, what
Yeah.
difference it made to them. And, so those findings are really driving us to go to the next step. They
Yeah.
enjoyed it, and I think one of the things that we were getting the feedback from is that they were telling other people at work that they were receiving therapy, almost unheard of, they were
Yes.
saying,
Yeah.
particularly in that setting. They were using a common language around how they were feeling. And rather than seeing it as something that was problematic, it was an opportunity to share.
Yeah.
I'm finding things challenging this week. My stress bucket, to use one of our analogies, my stress bucket's a bit full, and they were able to share that with each other. But the key finding was that they had tools to cope better.
Yeah.
They were prioritizing. They felt that they were more productive, but there was that lovely ripple effect in that they
Yeah.
were feeling like they were being more successful and more content at home as well as at work. And that's what drives us as therapists, isn't it?
Yeah.
Is
Yeah.
seeing someone's
Absolutely.
life transformed. It
Yeah. Yeah.
isn't just
Yeah.
about, it's wonderful
And
that there were so many of those officers and staff who got back to work because they were signed off sick, but like you were saying, also prevented them from going off sick.
yeah. Yeah.
And
Yeah.
then they have the tools to continue. So for us, yeah, we don't want to stop here.
Yeah.
We really want to carry on doing research. We would love it to be at the point of doing a randomized control trial,
Yeah. Yeah.
perhaps comparing solution-focused hypnotherapy with CBT
Yeah.
in a designated area, perhaps. Blue light services is a
Yeah.
particular area of
Yeah.
interest to us.
Yeah.
But yeah, we don't want to stop here.
Very exciting work. Thank you so much, Emma, for sharing that with me today. Thank you very much.
Oh, thank you.